Good evening, everyone. I am Dr. Mohammed Fahim, and I'm a faculty at Conceptual Orthopedics. And today I'm extremely proud to sit with Dr. Anuraag Mohanty, who has secured an outstanding rank of 52 in the NEET SS this year. So, first of all, Dr. Anuraag, congratulations. Uh,
Thanks a lot, sir.
Tell us, how does it feel?
Sir, the feeling that I had when I realized that I have gotten this rank was quite surreal, to be honest, because it is not every day that you hear that you have gotten a rank, and I obviously worked towards it for quite a while. It was something that I have wanted since a very long time, and I hope that this rank is eventually able to get me closer to my goal.
Great. That's always the thing. So, take us back a little bit. Where did you start from, and how was this journey towards NEET SS? Was it a journey filled with confidence, or was it filled with the rocks and the humps that most of us feel when we give such a competitive exam?
Yes, sir. It was a rather bumpy ride, I'd say, sir. But one thing was clear in my mind, sir. Sir, even before I started my residency, I always had this vision, this dream that I wanted to become a hand surgeon. And there are various ways of going about it. Super specialty in orthopedics as of now is not yet as developed as it is in other branches. So I tried to look for avenues, and one thing that I realized was in order to become a hand surgeon, I'd have to become an orthopedic surgeon first. So I did my residency at a great college at Kalinga Institute of Medical Sciences, Bhubaneswar. And there I got lots of exposure to various procedures, including hand surgery. But even before that, I knew that if there was something that I would like to do, it would be this. So, out of all the avenues that I found would take me towards the path of becoming a hand surgeon, I believe that the best would be obviously NEET SS, because I would be able to get an MCH in hand surgery, and it would be a 3 years journey where I would exclusively learn about it. So that was how I started my preparation. I did not prepare specifically for NEET SS, but I took Conceptual during my first year of residency itself. And I used Conceptual for all my study needs, be it for exams, for tests, for practicing MCQs, for learning about various cases, for case based discussions. And throughout this journey, the NEET SS prep was integrated into it. And I finished my profs. So I finished my finals, my PG finals, and post my PG finals, I did a few MCQs. I prepared for it and I gave the exam. And just based on that confidence that I had while I was studying for my finals, I gave the exam, and well, I'm very thankful to the Almighty that this is how I've ended up now.
Okay, so that was going to be my follow-up question, but you answered it. I was just going to ask how long you have prepared it, and I think that answers for itself that you are fresh out of PG life, and this was your first attempt, and you have cracked it. Again, I think this is all because of your vision. You always wanted to be a hand surgeon, and you've really worked hard towards it. So, I mean, I'm really proud of you to have, you have a goal and you've worked very, very hard towards it. And of course, you told us about the role that, say, conceptual orthopedics has played during your PG life and help you in the preparation as well. So I'll not delve on that anymore. So on the exam day, when you were there, uh,
Yes.
how did it feel?
Well, uh, it was quite a difficult situation for me to handle, because I knew that this would be a make it or a break it moment. I was fresh out of PG. I had not yet gotten into a senior residency anywhere, and I had put all my hopes on this one exam that it would be the one to take it forward. And I was finally there on that day. I was getting pulsations while I was getting palpitations while I was like answering questions, but then I kept myself calm. I trusted my preparation. I trusted what I had read and what I had been taught by not only the books, but also by the various sources, by my teachers, by my patients, and I just trusted the process and gave my answers.
Great. Just a thought, I mean, a small question about the time management. Were you able to manage your time during the exams well? Uh,
Yes, sir.
you could finish the questions easily within the given time limit.
Yes, sir. So time management was not very hard for me because the questions, there were a few tricky questions, but most of the questions were rather direct. And of course, there were a few conceptual questions, but yeah, once I got around them, it was not difficult at all.
Great, great. So now, if you had to give one advice to your juniors or for the other residents who are preparing for NEET SS next year, what would it be?
Well, my main advice to those residents who are preparing for NEET SS, who have a vision in mind to take a particular branch, is that trust the process and go ahead with your residency. You, while you're reading for your residency, you read as if you're eventually trying to attain your end goal. You don't have to really do anything extra apart from what you're reading for your residency to have a crack at NEET SS. Obviously, a few question banks here and there, a few mock tests, they do help. But the main source of preparation is what you learn during your residency, be it in theory, be it in case based discussions, be it in clinical case presentations. Just need to absorb everything and use that to full effect while you are preparing.
Great. So, Dr. Anurag, we are really proud of you. And this is the beginning of a new journey for you now. And I wish you the best of luck and a lot of success in your next residency for super specialty. And then onwards, I'm very sure you're going to make us all proud as a renowned hand surgeon. I hope to learn a few things from you as well later in life and hope everything goes smooth here onwards. So that was Dr. Anuraag Mohanty, ranked 52 in NEET SS this year. And thank you so much for spending these 5 minutes with me and letting us know about your journey. Thank you, Dr. Anuraag.
You're welcome, sir.
All right. So, Anurag, if you're coming towards Manipal, please let me know. Okay, because a lot of my juniors have joined there as hand surgeons. And it's trust me, the department is very big, it's very nice, and it's very integrated with their occupational therapy and physiotherapy departments. And I myself send my brachial plexus and my neglected hand surgery surgical cases there. Okay, so the case study is great. So if you are coming here, I'm very sure these 3 years are going to. So you are from Bhubaneswar itself?
Yes, sir. I am from Bhubaneswar, sir.
Yes. So I'm very. And are there many hand surgeons there?
Uh, there are a few, sir. In fact, sir, my father is a hand surgeon, so
Oh, he's an orthopedic surgeon as well, or
he
he's a
is
plastic
an
surgeon
he is an
turned hand.
MS Orthopedics, MCH Plastic Surgery, sir.
Oh wow, wow. So you never told that. So you have already had a lot of the way you told that you always wanted to be a hand surgeon. So I think there are far greater, I mean, inspirers for you. So the inspiration has definitely come from that, and I hope you take this forward. And yes, I'm definitely looking forward to meeting you in a lot of conferences as faculty in the future.
Thanks a lot, sir. It was a pleasure talking to you. Such a pleasure.
Yeah. All right, have a good day. And yes, enjoy this period. It's going to be really nice.
Thank you, sir.